Influenza A, done by Chase Stowe, myself, and Sam Jackson. What is the disease? Influenza A, or the flu, is a contagious respiratory illness caused by influenza viruses that infect the nose, throat, and sometimes the lungs. Some of these symptoms may include a fever, cough, soreness, a shortness of breath, fatigue, soreness of the throat, runny nose, body aches, and headaches. This virus mainly damages the respiratory tract in your body, and this is caused by the continuous of the large number of coughing that your body will go through and you will do just repetitively over and over and over. The time period that the influenza or flu lasts is you'll notice it is within the first 1 to 4 days, and then it will last about a week, 5 to 7 days. Some more of what the disease is, information continued. The overall prognosis of the influenza virus is it is an acute respiratory illness caused by infections with all the influenza viruses all put together is one. Depending on your health, when you do get the influenza virus, it'll be more or less hard on your body or severe to the individual. For example, if you have like asthma, due to the severe amount of coughing that may take place when you have the virus, it could be worse for you than others. Everyone will get the flu in their lifetime at some point. It will just depend on how bad or what the severity of it is. According to the CDC, 9.3% of children from age 0 or baby to 17 will get it. 88% for adults 18 to 64 years of age, and then 38% of adults older than 65. Basically, depending on who you're around, when you're around them at the time of season, which for this influenza A or the flu, it's more acceptable for you to be getting it in the fall or winter seasons. But in general, if you're around more people, you will be more likely to get the flu.
Okay, so here we have the influenza A pathogen itself. Got a nice picture right here. Courtesy CDC, gotta love those guys. So this, the influenza A pathogen belongs to the Orthomyxoviridae family. And the influenza A virus is surrounded with hemagglutinin, which that is this supposed to be blue, you can tell that there. And then the maroon one is the neuraminidase, right there. And then the purple is M2 ion channels. And there's sort of different combinations of those. There's 18 different hemagglutinins and 11 different neuraminases. And an example of what would make that one would be like a subtype of influenza A is like H1N1. I think a couple of years ago that was a pretty big thing going around. And a thing that makes the influenza A pathogen really like an issue is it rapidly mutates, and so it's kind of hard to develop a vaccine for it specifically. And sometimes like a person will get the vaccine, and then by the time you have the vaccine, it's already mutated 2 times, so you're not even protected with the vaccine anymore. And the typical response initiated is, it's just your body's immune system. So antibodies are created to fight infected cells, and phagocytosis occurs for the pathogen itself. So your white blood cells are essentially eating the pathogen. And here is the life cycle. So here we have a picture. And this is pretty typical, again, for most viruses. So you have the viron itself, and it attaches to the outside of your cell, and it goes into the cell, and it releases its, in this case, RNA. And the RNA is replicated in the nucleus with basically what your cells use to replicate DNA. And then it's basically like put together, then you get the proteins, and the proteins create a new virus, and it keeps pumping out new virus cells, and then those cells float around in your body, and this process just keeps happening hundreds of times over. And the best living conditions for this virus are less than 20 degrees Celsius, and also a pH level that is greater than 5. So our blood pH is like 7.3, 7.35, so that's prime conditions for this virus. And that's also why we see a peak of infections during the cold months, is because this virus really thrives off of that cold temperature. It does not do well in the heat. And the incubation period, as Mitch mentioned before, is 1 to 4 days. So there's a couple different ways we can diagnose an individual with influenza A. We have 2 rapid tests, one being the influenza diagnostic test, and this just measures for antibodies in the body. It takes 15 minutes, but it's not 100% accurate, so it's kind of like the rapid COVID test. It can be, if it's positive, then you're most likely positive, but if it's negative, you can also still be positive because it didn't get enough antibodies to have the test turn out positive. And then rapid molecular test, this detects the RNA of the virus itself, and it's more accurate because it detects the virus itself. And it's 15 to 20 minutes to get results. And more accurate tests can be done if you send the swab into a lab. This can take 1 to 2, maybe 3 days to get results back. But if you're positive there, you're positive. Or if you're negative, you're negative. There's no questions about it. And the swab itself is a nasal swab, or they'll swab the back of the individual's throat in order to get the sample for the tests.
All right, so now we got the mode of transmission here. So the first thing we're going to talk about is vectors. So for nurses, we learned about droplet precaution. One of the things we actually talked about was the flu and influenza. So when it comes to droplets, they're made from people when they cough, sneeze, or even talking through air. So these droplets can land in mouths, noses, it can land on people, it can land on objects, handrails, tables, chairs, anything, you name it. And these things have potential of going into the lungs. And again, Mitch talked about it a little bit, people with those underlying conditions, that can really be a problem. And then another thing, that's most likely the way that you're going to get it is through transmission, and it's going to get into your immune system, your lungs, things like that. Another way that you can get it is, again, someone sneezes or coughs on a handrail, a table, then you're touching that handrail, or you're doing something on the table, and then you're rubbing your eyes, or you're trying to blow your nose, maybe eating yourself. You don't wash your hands before you eat. That's kind of gross, but you never know. So yeah, that's how it can be transmitted. And then we're going to look at the nosocomial way. So influenza is common this way. Serious outbreaks can occur if you think in elderly long-term facilities. If you're a CNA, you might be working in one of these. They're common in renal transplant and oncology units in a hospital, and intensive care units along with pediatrics, because younger children are at that high risk. Again, Mitch talked about that a little bit because their immune systems aren't fully developed. And then again, it can be cross-contaminated through staff working in a hospital or a unit, things like that, from patient to staff or staff to patient. And then again, we've kind of talked about this already. Symptoms, they can begin from 2 days. The range can be from 1 to 4 days of the virus entering your body. And then the length of sickness really depends on the person. If you're having underlying conditions or if you're a healthy human, it can last from 3 to 4 days up to weeks. And then, like I said, your most contagious period is that 3 to 4 period mark.
Okay, after some technical difficulties, we switched rooms because the projectors at Dort suck. Okay, so before I talked about the vaccines, and it's hard to develop because the virus mutates all the time. So one thing that scientists did in 2013, they developed a vaccine that targets the, what is it called? The hemagglutinin on the outside of the virus. So it kind of works the same way like the current COVID vaccine works. So we're injecting the hemagglutinin basically into your body, and your antibodies learn to recognize essentially on the outside of the virus. So once the virus gets in there, they recognize the outside, and that hemagglutinin doesn't change often. It doesn't mutate like the virus itself does. So this isn't a 100% way to be safe from the flu, but it is much more effective than the older vaccines that were being used.
Okay, looking ahead here, addressing the influenza as Christians, we got to remember that having strength and through prayer, a lot of great things can happen. And again, just know your community and know that people are surrounded by you and they will always help you through the grace of God. Another thing that I just put up here is the flu vaccine can be beneficial. Just remember that it's not always 100% effective. It's just to prevent, not a cure. And depending on those underlying conditions and what strain you get of the flu vaccine is going to depend how it works. That's something we just also have to take into precaution when we're thinking. So looking forward into where we're going with this progression. It's very tricky. We've talked about it all this presentation about how whether it's a mutation of it or whether it's different strains other than just influenza A, different things are going to happen and we can't control those. Now, the University of South Florida has a program. They're donating money and time and effort into it, trying to make a universal flu vaccine that you could get every year that will be protect you over every strain and somehow stop mutation. I don't know exactly how it works, but I think it's cool that they're setting forward time to do that. As of now, we just have the regular flu vaccine that you're going to get every year, and they're going to take a strain that they feel is most prevalent. I believe it's in China. They research it and then put it in our flu vaccines to help us out. Hopefully we can get a good strain in there so that the flu vaccine works, because nobody likes the flu. And I believe that's it. And there's our sources.